let's talk about stress incontinence, because that's the one that I hear when people are talking about it. It's when they run, when they cough, when they sneeze. So let's talk about it. You tell me about that.
So stress incontinence occurs when you cough and sneeze and laugh, and the support structures to the urethra and the bladder aren't as strong as they used to be.
The support structures, what are the support structures?
Basically the tissue within the vagina. There are muscles and ligaments and tendons that help to lift the urethra and support the urethra so you don't leak on yourself.
So where is the urethra in relation to the vagina?
So it's right at the outside of the vagina. It's on the top part of the vagina.
Okay, and when you look at the urethra, and as a urologist you have to look at that, what does it look like, just the urethra, when you're examining a woman?
Kind of a small hole, not very much bigger than a small button.
So what happens is then with stress incontinence, what happens?
The urethra may lose its support and drop down, and it loses pressure underneath the urethra. So when you cough and sneeze and laugh, urine will come out because there's not enough pressure in the urethra to keep the urine in the bladder.
So you have to plug it up? What do you have to do?
Well, there are conservative treatments. Oftentimes you try to do conservative treatments. You don't want to rush off to surgery. Kegel exercises or pelvic muscle.
How do you Kegel? K-E-G-E-L?
That's exactly
Kegel
right.
exercises?
Right.
What are those? Walk me through those.
So a Kegel exercise is when you squeeze your bottom, basically like you want to stop urinating. And that's a Kegel exercise. So we teach women how to do different types of Kegel exercises to make that muscle stronger to maybe help hold back the urine.
Is it a new learning? Is it a new bunch of muscles? Or we all try and not have incontinence, so we all know how to try and hold it? It's the same thing.
Most people know how to activate a Kegel exercise. We just need to teach you how to do it efficiently so that it can be helpful. It only works about 50% of the time, though, and you have to continue to do it. So most people don't do very well with Kegel exercises.
Okay, so the reason is non-compliance. They don't do it enough.
Exactly.
But it can help.
It can.
So after conservative, then what are the other approaches we have for stress incontinence?
So there's surgeries to help with stress incontinence, a sling procedure. There are several different types of suspension procedures for the urethra. Some are older that we use with abdominal approaches, small incisions in the belly to lift the urethra up to the pubic bone. It's called a Birch procedure. There is a pubovaginal sling, which is a very fancy word.
Pubovaginal sling. Now, so we're talking about urethral slings to support the urethra. Is that the same type of mesh? You said that's mesh. Is that the same thing as supporting the bladder?
So that's a little bit of a different procedure than the mesh. It's using a piece of your own muscle, or sometimes people even use pig muscles or even cadaver muscles to lift the urethra or the bladder neck, and you support it to the pubic bone. And then the newer procedures are the slings procedures with mesh.
Okay, and how is that done for the urethra? Because I know one patient that had that, one of my nurses as a matter of fact, and it was amazing. She did so good. Tell me about it, because you don't have to go in the hospital and have big bed surgery.
So it's about a 10-minute outpatient procedure. You do go to sleep.
10 minutes?
10 minutes.
You do go to sleep.
Right. You make a small incision underneath the urethra, maybe a centimeter or a third of an inch. And then sometimes you make either small incisions above the pubic bone or on the inner thigh. And you put a piece of mesh that looks like Scotch tape with holes in it, is how I describe it. And it goes underneath the urethra, and then we put
so you sling it underneath. You sling it underneath,
right? Kind of like a hammock,
and sort of pull it up a little bit.
Well, you pull it up, but you don't want it to have any tension. You don't want because it can put the patient into retention where you can't urinate. So you have to do it without tension, and the body actually incorporates that mesh into the vagina, into underneath the urethra, and that's where it gets its long-term support.
So my nurse that had it said it was the best thing. She couldn't believe how good it was, that it's worked really good. What are the results you get in most people with this urethral sling?
So 90% or better success rates where you're cured. 1 to 2% may not have any improvement at all, which is a very low risk. Most people, if they don't get better, the other 8 to 10% may have a lot of improvement, may not be perfect. And so it's a very, very safe, effective, quick, and easily to recover from.
Now, is it 100% when it goes through? Are they just a whole lot better usually?
90% are cured.
Wow. What age group responds mostly?
Any age group. I've had patients in their early to mid 20s to patients in their 80s.
Okay, which one, I would think, the vaginal tissue and the support tissue would be better in a 30-year-old that had had 2 kids than an 85-year-old that had had 2 kids and it's getting older.
It may be, but all those patients seem to have very similar success rates.
Wow, that's absolutely, they must think you're their hero.
Well, I get a big hug on my neck sometimes.
That's great. So are there other kinds, that's a urethral sling, what else would you do for the stress incontinence?
Those are pretty much most of the options that we have available. There is so for some of the patients who don't have perfect results, there is what some people may call a filler or a bulking agent, and that's a very quick procedure, sometimes even done in the office, where you put a scope into the urethra and you can inject a bulking agent to increase the pressure on the inside of the urethra. And sometimes that can help kind of fine-tune the leakage if it's not perfect.